So there are now different types in terms of different ways to stimulate the ovaries, starting from actually doing a very natural approach where we don't use any medication or use minimalistic medication, to stepping up a little bit for a milder stimulation where we're using a smaller dose of medication throughout the stimulation of the ovaries, to the conventional IVF, which is where we use as required amount of stimulation or sometimes even higher doses of stimulation to stimulate the ovaries. Does one type of IVF suit all? No. Can I say this IVF is what I do only? No, that doesn't work like that. Every individual, I think I do believe in a very individualized approach and personalized approach. So I think IVF has to be tailor-made for that couple. So depending on what's your age, what your wear and reserve is, how many follicles you have, what are we expecting to get, that is when we decide what kind of protocol, what medication, what dose will be suitable for you as an individual. So no, one type of IVF doesn't suit all. That's not what I believe in. But I'm sure that for individual, as your individual case, there will be something or the other that will fit in perfect for you. So for timeline, I would say starting from the consultation, that is the initial part of it. And I always advise to have a consultation with your fertility assessment, as we call it, consultation package, where we would know your initial ovarian reserve if you are a heterosexual couple, and a semen assessment for your partner, or if depending on, if you are same-sex couple, gay couple, we would find the initial information about you in that consultation. And starting from the consultation, we take probably that initial month as a preparation month to kind of order your medication. Nurses go through the medication. You have to fill in certain consent forms that are required. You will have to go through certain screening blood tests like HIV, Hep B, Hep C, which are required for treatment. All that is done in that first month. And the following month is your treatment month. So I would say overall, it can be a process of around 2 months, in which the main treatment month or the cycle starts. And in that cycle is when you will be taking medication to stimulate your ovaries. You will have your egg collection and you will have your transfer. And 9 days after transfer, you will have your pregnancy test. So start to finish in a month, you have overall the whole treatment and the result of it. So if you are considering IVF, so that would mean that you've already done, for any woman who was younger than 35, we say you should try for at least 1 whole year of regular unprotected intercourse. Over 35 is a time period is for 6 months. So I'm assuming that you've already done that and you have not been successful in that given time period, and now you've started to consider other options for yourself. Again, knowing a little bit more information, like having a tubal patency test to see if your tubes are open. And again, if you are same-sex couples and you're thinking of using donor sperm, if you are females, or if you are males, same-sex couple, and you have to use donor eggs or surrogate, if you are considering all that, what initially what you need to do is to be in general good health yourself. So if you are a smoker, we would advise you to stop smoking. If you drink alcohol and it is beyond your normal recommended units, which is 12 to 14 for females or 14 to 16 for males. If you're drinking any more than that, we would advise you to reduce your alcohol intake. We do advise you to have at least 3 to 4 times a week or activity or exercise schedule, so that your body is in a good BMI, a good health status. We do advise women who are trying to conceive to start taking folic acid and vitamin D, or any prenatal vitamin is recommended. Having good sleep and having, if you're dealing with, let's say, high stresses in life, which could be at work or at home, it's always recommended. I know fertility itself can be a very stressful thing to work on, you know, but having stress-free, maybe being a bit more relaxed, maybe, you know, having proper good night's sleep and not working for long hours will be a good start to your fertility journey. Emotional aspect of a fertility journey is very, very taxing. And it's highly recommended that first is that you talk about it. Talk amongst yourselves. There could be family, friends, your support around you. It is still considered as a taboo, and I think we need to overcome that. It is a very common finding, very common thing happening these days. 1 in 7 couples will be struggling to conceive. So it is okay. You might start talking and you might find someone at your work, someone in your family, or someone, one of your friends, who is also going through the same. So talking first thing is a very important step in giving yourself that little bit of emotional support. Counseling is another thing that we have, we provide here at City Fertility. Even if you have started to think about it, thinking about IVF, thinking about going into fertility treatment, having a counseling session, a counselor might help digging into those fears that you have inside yourself, which probably you haven't even thought about. But when you talk to someone, again, talking is the important thing. And if you can't find family or friends, a counselor might be very, very helpful in just coming and overcoming those fears and overcoming those deep-seated questions that you might have coming for this. So, and of course, you know, I would always say the team at City Fertility is always there to emotionally support you throughout your journey whenever you need us.